Hello, my name's Jim Huddy. I'm a GP in Cornwall and I'm the clinical lead for chronic pain down here. I want to tell you about the Chronic Pain in Cornwall project, where we've come from, where we are and where we're going. This is going to take 5 minutes, I hope. This is the team. So, moi, Keith Mitchell, pain consultant, who I've been working with for a few years regarding opioid deprescribing. And we were lucky enough along the way to meet Sean Jennings, who's our expert patient. And we've got social prescribers Nikki and Kevin, and the personalised care lead down here is Debbie O'Nions, and I'm pleased to say our Commander-in-Chief, Kate Shields, is fully behind us. GPs often ask us, if I don't prescribe, what do I do? Well, our mantra is skills, not pills, and what that means is that we want to give people with pain the skills that they need to live with it, rather than attempting to get rid of it with ever-increasing levels of drugs and interventions and surgery and such like, which often is rather futile. So the answer to the alternatives we've discovered is what we call the 10 footsteps to living well with pain, developed by Francis Cole. And if you ask people with pain what they suffer from, it's typically being physically inactive, not sleeping very well, problems with employment, problems with moods, relationships, and this is the antidote to that. Last year we made an application to the Queen's Nursing Institute for funding, and they've given us funding for Francis Cole, who developed the 10 footsteps, to perform some training for our PCN social prescribers and health coaches. So the ARR roles are going to get trained in the 10 footsteps, how to deliver it on a personal basis to patients, but also on more of a sort of system-wide basis. I'll tell you that in a sec. Hang on a sec, stop. Not just social prescribers and health coaches on the invite list, there are others. We just need 2 engaged, passionate champions from each PCN. Could be social prescribers, health coaches, or community nurses, practice nurses, community navigators, OTs, or clinicians, doctors, whoever. As long as they're interested and up for it and want to help people with pain, that's what we need. Okay. As a sideline, Francis Cole also has gabapentinoid and opioid training toolkit, which is another training program. That's for PCN pharmacists, but we'll park that for a moment. So the whole idea is to try and demedicalise chronic pain as much as we can. Some people do need medicine, do need interventions, that's fine, but we're trying to carve off those that don't, because often if they see doctors, things go a bit wrong, no offence. So we can, once we've got our training done, we can identify people with pain, we can contact them through our GP systems and our communication tools that we've now got in our systems. And what we did in Perranporth, which worked really well, is set up what we call a pain cafe, run by social prescribers, demedicalised, teaching patients what they need to live well with pain. Now, we've got some vehicles that we think we can help us along the way. Particularly, there's the PCN Direct Enhanced Service coming up, which is NHS England contracts with PCNs to deliver personalised care, and we're hoping to ride that wave in helping us achieve what we want to achieve. We're in close communications with the more medical side of pain care delivery, MSK Interface Services and the RCH Pain team. And what we're hoping in all, this is a bit of a mess, this one, but what we're hoping eventually is to build up a kind of map of pain care in Cornwall, whereby each footstep is covered in all areas by various providers, whether that be family, friends, carers, digital technologies, or more traditional NHS services. So this is our strapline. We're going to be weaving patient outcomes into the fabric of service design. And what that means is that if we all follow this 10 footsteps model and we can deliver the 10 footsteps, then we know we're delivering what patients need. We've got tech on our side. We've got our website is in evolution at the moment, and also the Help at Hand app. We're hoping to get chronic pain front and centre on their drop-down lists of where to go. Years This is a sort of 5-year project. Years 2, 3, 4 and 5 is going to be more research based, finding out what patients want and working out how to deliver it and delivering it. And we've got contacts all around the land. We're hoping that other people will be able to follow us. And I'm running out of time. And our 5-year outcomes, well, I've sort of mentioned that, and challenges and barriers, social prescribers' longevity, PCN appetite. We're hoping with the backing and with your help we'll be all right. Might have gone slightly over time. Apologies. Goodbye.